Hello everyone, my name is Billy Ensign and I'm a student as part of this college transfer success class. Today I'm going to be giving you a little bit of a PowerPoint on nursing as a career, including things like the wages, the outlook, things of that nature, as well as the employment. So, an introduction. They typically fill the niche of direct patient care. Now, they serve as the eyes and ears for doctors and are mostly employed in hospitals. They'll usually require a 2 or 4 year degree, and they're in very high demand as a result of several factors, which I will elaborate on later in this PowerPoint. So, the entry level pay will vary greatly from state to state, but the national average is about $61,000 as of 2020. The highest entry level wages are usually going to be found in California and Massachusetts, but adjusted with the cost of living index, New Mexico is actually on top. Unfortunately, North Carolina is relatively low on the rankings of starting RN salary. Ending salaries are typically more influenced by specialization, but they can be as high as $120,000, in high-paying states. They follow the same pattern as entry pay in relation to location and cost of living and so on, with New Mexico being the leader adjusted to the cost of living index. And most RNs were retired 50s or 60s because of the fact that it's a physically demanding job. Usually you get early retirements. Some degree types would be the associate's degree in nursing science. That's usually a 2 year thing, and that's more suited for quicker education, but the pay will be lower than BSNs typically. Now, a bachelor's degree in nursing science is a 4 year degree, and you would usually have higher pay as well as more advancement opportunities. It's a rapidly growing career, and it's projected to probably increase by 7% by 2029. Now, much of the RN population are aging towards retirement, and as a result of that, there's going to be a big, hole to fill once they begin retiring in mass. Now, also consider that the already rapid growth is being hastened by the COVID-19 pandemic, and we'll probably see, unprecedented growth in this field, which makes it very appealing. So, some relevant majors. An associate's degree in nursing is going to offer you a shorter education, and it's ideal for entry-level staff nurse positions. Then, a bachelor's degree in nursing is typically a 4 year degree, but it offers higher paying positions as a whole. Some notable employers would be Vidant Medical Center, UNC Health, Lenomo Memorial Hospital, the NC Department of Health and Human Services. And then some of the biggest areas for nurses, concentration-wise, would be New York, Los Angeles, and Chicago. Some required skills. Compassion for those experiencing pain and mental anguish. This is a very big part because, you probably won't get far if you're trying to be monotone in your career because a lot of people interaction as well as teamwork. Quick thinking. You'll probably be on the floor, having to make some important decisions, communicating with your team with those quick decisions, which brings us on to the next one of having team-oriented skills such as communication. Basically, the biggest job of being a registered nurse is working as part of a team of other registered nurses and communicating your findings with the doctor on the floor. So you really have to have your game up on that sort of skill. Then ability to manage stress. Obviously, very stressful career if you've asked any RN about it. Probably why it's so high paying. And then endurance. You'll probably be moving quite a bit around the floor, but this also is referring to mental endurance and emotional endurance because you'll be going through quite a bit of stress on both those ends. That's all. I hope you all enjoyed and learned a little bit. And here are the references in MLA format. And that is all. Thank you for listening.